Texas nurse Amber Vinson, who was declared free of Ebola virus and discharged from Emory University Hospital, said Tuesday she is so grateful to be well. Vinson, 29, and Nina Pham, 26, were the two nurses at Texas Health Presbyterian Hospital in Dallas who contracted the virus while caring for Thomas Duncan, a Liberian national who died of the disease October 8. "I'm so grateful to be well," Vinson said, reading a brief statement to reporters. "With God, all things are possible." Smiling broadly and occasionally brushing aside tears, Vinson was surrounded by relatives as well as Emory doctors and nurses. Pham was released October 24 from the National Institutes of Health Hospital in Bethesda, MD. Vinson, who was admitted to Emory University Hospital in Atlanta on October 15, also thanked those who treated her during her 13-day battle with the deadly virus. "As a nurse and now as someone who has experienced what it is like to be cared for through a life-threatening illness, I am so appreciative and grateful for your skill, warmth and care," she said. As she left the room, Vinson individually hugged each nurse and doctor gathered around the podium. At the brief news conference, Bruce Ribner, medical director of Emory's Serious Communicable Disease Unit, officially declared that Vinson was free of the Ebola virus and was being discharged. "We have determined that Miss Vinson has recovered from her infection with Ebola virus and that she can return to her family, to the community and to her life without any concern about transmitting this virus to another individual," Ribner said. Asked why Vinson, and fellow nurse Pham, recovered fairly quickly from the virus, Ribner said, "The honest answer is that we're not exactly sure." He said that the nurses' age and circumstances of how they contracted Ebola may have been factors. "They are two of the youngest patients treated in developed countries," he said. "We know from a lot of data that younger patients do much better than patients who are older." He also appeared to address the controversy over how Ebola patients, and those who care for them, should be treated by the broader public. "We must not let fear get in the way of our primary mission, which is caring for patients with serious diseases like Ebola virus infection," he said. Texas Health Presbyterian Hospital in Dallas, where Vinson and Pham worked as nurses, issued a statement calling her discharge a joyful day. Like many of her colleagues, she made a brave choice to volunteer and provide care for a critically ill Ebola patient, the hospital said. That led to a personal fight against the disease, and she is to be commended for her strength and courage. The statement said that the two nurses are an inspiration for healthcare workers nationwide, and we at Texas Health Dallas could not be more proud of them. Vinson came under criticism for flying to Cleveland shortly after Duncan died despite her extensive exposure to him. Thomas Frieden, director of the Centers for Disease Control, initially said Vinson had violated CDC guidelines against anyone using public transport while undergoing self-monitoring for exposure to Ebola. But a CDC spokesman said later that Vinson had spoken with the agency and was cleared to fly from Cleveland to Dallas by the CDC official responsible for monitoring her health. Vinson's family defended her in a statement at the time. Suggestions that she ignored any of the physician and government-provided protocols recommended to her are patently untrue and hurtful, the statement reads.